My name is Michael Morgan-Curran. I'm Head of Clinical Development and Commercial at MyCognition Limited. MyCognition started about 5 years ago, and what we wanted to do was investigate fully the impact of impaired cognition on the population. We're very acutely aware that the population is aging and that has consequences not only in terms of health but also in terms of social care. And we also are aware that as we age we become less productive. What drives all of that is our behaviours and impaired cognition, and certain disease states themselves trigger and accelerate the progression of cognitive impairment. And that's what we wanted to study. There was a huge gap in terms of research and available data. We wanted to plug that gap, but we also wanted to look at what kind of technology we could develop as an organisation that could not only measure cognitive impairment satisfactorily, taking a very standardised scientific approach about it, but also develop technology that would actually improve cognitive impairment and make a meaningful difference for patients and healthcare providers. So what we've developed is an application which is threefold. It has three components. The first component is called MyCQ. That's the world's first validated assessment app which can be delivered in 15 minutes, measuring people's cognitive impairment across 5 key clinical domains. And with that data from MyCQ, it powers an interventional support game called Aquasnap. It's an immersive video game which is fun, which every age group can use, and they can use it on any iOS or Android device. And that game itself, powered by the MyCQ data, improves people's cognitive impairment within 8 to 12 weeks. And as people's cognition improves, it's important that their behaviours and their lifestyle is improved as well. And we've developed a healthy habits component which drives sustained behaviour change. Yeah, so we're really excited at MyCognition because we've been working with NHS England and NHSX for the last 3 years. And we've been doing that to try and make sure that we penetrate the NHS, we're implemented by the NHS, and we're adopted and spread in a very systematic way. So that means we've gone down the route of making sure that it's CE approved as a medical device and regulated by the MHRA. We've been working with the Academic Health Science Network to make sure that we work with the networks across the country to make sure that clinicians and CCGs and doctors and psychiatrists and specialists are getting access to MyCognition so they can consider how they would implement it and roll it out within primary care. We've also been working with another series of organisations that are responsible for accelerator programmes like the NHS Diabetes Testbed programme that we're involved in, as well as the East Midlands Academic Health Science Network Digital Health Accelerator. All of these mechanisms, all of these opportunities which are rolled out by NHS England and NHSX, we're attempting to monopolise and support the spread of our technology and its uptake. Well, we would like MyCognition to be used and recommended by every GP in the country. At the moment, GPs have got no way of identifying whether people have got impaired cognition or not, unless they use the traditional paper tests and the Cantab battery of tests. MyCognition offers a real alternative to that, and in fact it's the only alternative that's regulated as a medical device and available now, and that can be used by any patient easily on their phone or their tablet application. Every GP then can monitor people's cognition and how that improves over time. And it's really important as well when we're considering that as the population ages, we're going to have to treat more and more people that have got mild cognitive impairment and dementia. And MyCognition offers a real support for people with those conditions.